Can you describe in more detail your decision-making governance for all stakeholders? Is it formal or informal?
Great question, Ken, and hello, Ken. So our governance structure, we convened a one-day kickoff meeting where we flew in all of our stakeholders for an initial study meeting, and we created our governance structure with them that day. It addressed communication, expectations for monthly meetings. We were surprised at how strong they felt about establishing very clear boundaries about how many meetings a year you had to attend, what the wiggle room was in terms of showing up to one of our meetings a few minutes late, what was the cutoff for being paid and not paid. We had to set up a structure for clarifying when we seek feedback on a monthly basis at our meetings, what our structure was for developing a plan and then responding back to them on what our action steps were going to be based on the guidance that we sought for a given topic. Often we were coming to them with our own clinical dilemmas, particularly as COVID emerged, of here's what we're struggling with, help us figure out an answer. And if we did not come to a consensus during those meetings, that those would be the first action items on the agenda the following month. So those are a few examples of how we established our governance structure. In terms of fostering communication, we also use Basecamp as an internal communication structure. So we save meeting documents there. Results of all of our surveys are saved and accessible for each of our advisory committee members. And they actually also requested to have a place in Basecamp to celebrate each other and share good news. So we've really created this community of, you know, when grandchildren are joining our families and people are graduating, getting certificates, any little successes have been part of this celebration as well. I hope that addresses that question.
Great, thank you. And here is a question from Paul Blasey. Excellent talk. I just wondered, in this context, it seems stakeholders is synonymous with patients. Were there any differences engaging patient partners and other stakeholders in your research?
That is a great question. So in our projects, we have included a wide range of individuals. We try to engage them in the same meetings and activities. Sometimes the way that we do it is different. For example, we have, at the beginning of our project, we had a certified nursing assistant who, she's awesome. But given some of the other people on the committee, she wasn't comfortable raising her voice and sharing her experiences. So what we ended up doing with her was we had preparatory meetings where we would kind of talk through the agenda and help her to be comfortable with the information. And over time, that additional prep work has now provided her with the self-confidence to find her voice, and we no longer have those prep meetings. But that was one of the strategies that we used because we wanted her perspective. It's been so important. There have been some other strategies that we built into our grant in terms of having some funds available to support caregivers if they needed to, you know, have funds to cover respite care just so they could be part of a meeting. So kind of thinking out of the box in supporting engagement in our meetings. Hopefully that helps.
Thank you. I have, I think, a related question of my own that I'm going to insert here, but you've talked a lot about the goals of stakeholder engagement and the roles and the work that, that your group has done, which is amazing and considerable. Can you share some tips on approaches for identifying patient and family stakeholders for research? Like, what are some of the strategies to identify people who would be interested?
Great question. So there are a variety of ways, and the approach that each of you use may depend on your existing connections. This may require some upfront work if you are new to a region and maybe don't have some clinical connections and you want to have some local rehab connections or in a healthcare setting. So it may take some time building relationships with a facility and getting to know some of the providers, maybe running some initial focus groups, kind of building relationships with whichever community that you are trying to work with. I was recently talking to some stakeholder engagement experts here in Pittsburgh, and they had suggested, you know, for older adults, you know, reaching out and building relationships with area agencies on aging, the silver sneakers. So you're going to be capturing people in the community that may have had rehabilitation, sitting down with them, hearing their stories, starting to just build relationships. So much of stakeholder engagement really requires that upfront relationship building and having that opportunity to demonstrate your commitment to a broader issue than coming into a community to have your needs met and left. But those would be some examples of ways to access the rehab community.
Thank you. Here's a question from Cecilia Wu. In the process of collaborating with stakeholders, how do you decide who to invite to co-author manuscripts?
Great question. So to date on, at least in our project, we have tried to make sure that key perspectives that are related to the topic are what's informing us. So one of our papers was a systematic review on psychometrics. We had one of our stakeholders who actually has a background in measurement, but he's a provider as well. So that's he was invited to be a co-author and help us move a manuscript forward. We were working on family caregiver perspectives. So we invited our family caregiver to be part of that manuscript. We're looking at, you know, training and implementation. So our stakeholder her job is related to system-wide implementation of best practices in her job, she was then invited to be part of that presentation. So we try to make sure that anytime we're writing on a specific topic that the end user or the individual population that we are trying to talk about or talk with is represented on our manuscripts or presentations.
That's very helpful. Here's a question from Janet Prubecker. She says, great talk and on the ground experience, Natalie. Interesting to hear the study sponsor had input. Would you consider them a stakeholder? And what guidance would you give others for proactively engaging research funders?
That is a great question, Janet. So yes, I would definitely consider this funder, PCORI, to be a stakeholder. We still meet with our project officer every 2 weeks. We are well into 3 years on this project, so they are definitely considered, you know, one of our stakeholders. That's actually been one of the lessons we learned early on, is we are one of the few PCORI projects that has been funded in nursing homes. So we have done a lot of education to PCORI on research in nursing homes. And we've actually had our stakeholders help us put together a presentation that we gave to PCORI on nursing homes and nursing home research and healthcare policy. So they are definitely actively involved. And I would say for any researchers, you know, even in the NIH world, it comes down to building relationships with project officers ahead of time. You know, I think with PCORI, it's more after you're funded, but they are very engaged and hands-on, and definitely a stakeholder group to consider.
Great. A question from Steve Fisher, who says, very interesting. It looked like there was a wide range of backgrounds for stakeholders. Did you follow a particular strategy for paying and budgeting for stakeholder engagement?
Great question. So we pay everybody the same. It doesn't matter what your education background is. You come to our table with the lived experiences of your life. And so you get the same amount of money, whether you are a family caregiver, a CNA, or, health system leader who, has a large salary. Every single person gets the same amount of money. And that was a key belief of mine, because my goal to bring this community together was that we were in this together to solve an important problem. And I wanted to make sure that it was a level playing field, that every voice was valued. And so every person's paid the same.
Here's perhaps a related question, and I'm sorry if I pronounce your name incorrectly, from Toyin Ajisaf. How have you negotiated setting the tone such that the stakeholders feel they work with rather than for you within the governance structure?
That is a great question. And I will say I am lucky that we got to have an in-person kickoff because this study started before COVID. I would imagine it's much harder to set this culture that we did in a COVID world. But we actually started our kickoff meeting not with titles or references to, whether you have a doctor behind your name or anything like that. We have set up a philosophy that everybody goes by their first name. And we had everyone introduce themselves by their connection to our shared passion, improving care for residents with dementia. So that is what we heard was everyone's stories, which I would say 90% were about family members or a patient, or there was a very personal connection. And that's what really served as a launching point. And from there, we then developed that day, that governance structure. By the end of the day, we had, on chart paper around the room, that established culture. So I think it helped by kind of laying some ground rules right at the beginning.
And I think building on that, there was a question for Samanas from Samanas Koja. She said, she's wondering if you could share your thoughts, experience on engaging and bringing together multiple groups of stakeholders, such as community clinical providers, healthcare administration, and so on.
Sure. Hello, Samanaz. So I would say their background wasn't the challenge. Our biggest challenge was that we had 3 time zones represented. But by having everyone really identify with their personal stories and their motivation for being part of our team to really address how do we think about the best possible care for people with dementia, we really haven't had issues with there being different stakeholder groups represented. I will say there may have been some hesitancy of certain people at the beginning to share their perspective, but a few of those kind of prep meetings that we did ahead of time really improved individuals' confidence. And, we have a hard time sticking to our 1 hour just because it's always a very lively discussion. And it's a really community that has surrounds each other. But I would say we have not had issues in terms of kind of turf wars or having different stakeholders in the same meeting, because we all meet every month.
And about how big is your full group?
So our stakeholder advisory committee is 19 members. And we have, gosh, I think we're up to, there's 11 of us on the research team. So, we have about 30 people on the call. We do offer 3 different meetings during a week, just given life circumstances. But I would say our first 2 meetings of the week are the most of the people are on one of those 2.
Great. So there's a lot of people thanking you for your responses in the chat, which we'll save. I'm not seeing any new questions, but I really, really thank you and the audience for this wonderful discussion, and thank you for sharing your perspective. And I hope we'll continue the conversation after the discussions.